Hi everyone, this is Dr. Fred Macy. Today an important topic. How do you prevent a heart attack? How do you prevent a stroke? How do you prevent the bad outcomes that may result from these type of catastrophes, such as needing bypass surgery or stents or other interventions? Well, the first starts with your lifestyle, and that should start early in life, from your 20s and 30s, and especially if you have a strong family history of a first-line relative who may have had a stroke or a heart attack at an early age. For example, if you have a grandfather, grandmother, or perhaps your father or mother or some aunts or uncles who may have had a stroke or a heart attack in their 40s or 50s. This is a bad omen, so you need to pay attention. You need to know where you're at. That means visiting with your provider, your PCP, and obtaining general labs, among which will be your lipid panel, your hemoglobin A1C, your renal and hepatic function, and other labs that are pertinent. From there, you can gauge your risk over the next 20 to 30 years. If you are at a moderate or higher risk for heart attacks, you need to start as early as possible with a preventive strategy, with an appropriate diet that is mostly plant-based, such as a Mediterranean diet, and also an exercise program. You need to be active every day, at least 30 minutes or more, and above all, avoid smoking. Smoking is one of the main risk factors that predisposes you to have strokes and heart attacks. The other risk factors, of course, are hypertension, prediabetes, diabetes, and dyslipidemia, meaning high cholesterol and different forms of dyslipidemias that may arise genetically, such as familial hypercholesterolemia. If you have all or some of these conditions, you need to be under the care of a professional that understands what this is about and what is the main goal, because controlling those risk factors is at the root of preventing you from having a stroke or heart attack. And what happens if you've already had such an event? That means you have atherosclerotic disease. That means you have cholesterol deposits in your arteries, in the medial part of your main arteries, whether they be the arteries of the neck, the aorta itself, the coronary arteries, or the peripheral arteries. And if that is the case, you need to be in what we call secondary prevention. You need to be treated very aggressively for all the risk factors I mentioned, including the smoking, and draw conclusions from the fact that if you do not do this, and I'm telling you right now, looking at you in the eye, you will surely have another heart attack that you may not survive, or you will have a stroke that will leave you disabled. And this is a burden not only for you, unfortunately, but for the rest of your family. So, in summary, it's all about prevention. It's all about knowing your risk, knowing your family history, knowing where you're at, and then being consistent by staying on top of controlling these risk factors over the next 10, 20 years, and hopefully living a healthy life. And the last thing I'll say about this is that by doing this, you will also avoid the dreaded dementia, vascular dementia. You surely would like to go into your 90s knowing who your great-grandchildren are, knowing who your wife is, knowing who your friends are, without forgetting, without having memory lapses, without having those elderly moments that you don't have to have if you follow my advice in this regard. Hopefully, this has been of extreme help for you so you can get the help you need